Hello, hello, hello. Welcome to week 8, everyone. I'm Mrs. J, your curriculum developer here at AMCI. I'm one of them, and I'm proud. I'm so proud of you. I'm proud of the forensic coders you are becoming. You know what? Or you already were. you no longer just you're just no longer learning about diseases. You're thinking critically about applying those guidelines and coding with integrity. That means you're following the guidelines. Okay, coders, last week you mastered, well, some of you've mastered, and some of you are more proficient, and I love it. Chapters 15 through 17, that's pregnancy, perinatal, and congenital anomalies. Now, some of these, especially chapter 15, demanded that you pay particular attention to sequencing guidelines. That chapter 15 really had some aha moments coming through. I saw you. I did. Also, this week we're going to be stepping into chapters 18, 19, 20, and 21. This is signs and symptoms, injuries, fractures, external causes, and health status. And, the injury section, we're going to talk about fractures, burns, and poisonings. So, just to let you know, there are like four subsections of chapter 14 that we're going to focus on. Now, before I go any further, I just want to send a huge shout out to our instructors and intern team who continue to model excellence. You know what? To me, they are among the best, if not the best, in the industry. And coders, you are a part of a community that believes in lifting each other higher. Now, with saying that, I want to talk to you. All right, so I feel I need to say this and I need to speak directly to you YouTube students. Every question that you see in this course was created just for you. These questions are brand new, generated using AI. And the instructional team reviews these questions. So that means there may be some mistakes. Every scenario will not have the best or the most accurate code because sometimes it takes 4 passes for us to get all of the kinks out. It does. I don't think very many programs have that ability to give it 4 passes and to offer original scenarios never seen before just for you. And this is a good thing because that means that no, we aren't formatting these questions so you can get them right. It means that you're getting them right because you are doing the work. Now, if you are attending a course like the AMCI, we have our main course. Most of the questions in our paid course don't have errors. And the reason is because it's gone through more than 4 passes, maybe 10 passes. So it's rare to see it. And if you do see it, we fix it immediately. Also, we're fixing your questions and the errors, if any, immediately. So when you bring it to our attention, we fix it. And I just want to let you know some of you are expressing some concern like, wow, this is wrong, that's wrong. I want to let you know that is very, very discouraging to your peers. You shouldn't do that. And why? Why would you do that? Don't do that. Don't discourage others by negativity. And you do not see AMCI student team instructors, interns, nobody. We don't do that here. Okay? So we only encourage because that is what you need to succeed. We are not here donating our time to be undermined by negativity. So please, if you feel you have something to get off your chest, contact success and we will listen. But do not discourage your peers because your peers are telling me. So your peers have told me that there are some of you that are doing that. Please stop. All right? So that's all I want to say. Now, you got questions? We got answers, and I'm also going to let you marinate on that. All right. How to join Discord. This is the most common question. I think there's something going on. It is not simple. You do have to click on any lecture or video that we have, click join. After you click join, you're going to have to pay a premium. Then you have to click the Discord link. A Discord link should pop up. All right. After that link pops up, you'll need to link your YouTube channel. You're going to pop into the Discord. Now you'll need to link your YouTube channel. And this is how you do it. You're in Discord, and on the right, this is what you see. But down below in the right corner, right here, you'll see a cogwheel. Click on it. Then you're going to see this menu. Click on Connections. Then you're going to see all of the platforms that you can connect to. And you're not going to see YouTube right away because it's at the end. So click the continue button until you come to YouTube. Then follow the prompts. Now make sure you use the same email that you use on or with your YouTube channel, okay? Make sure your Discord and your YouTube emails are the same. CPT is copyright of 2025 AMA. All rights are reserved. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD-10-CM Flip Tap, and MCG are registered trademarks of AMCI. CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. And CCA, CCS, CCS-P, RHIA, and RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials. Goals of the presentation for week 8. Number 1, we're going to review Chapter 18, Signs and Symptoms. Number 2, Chapter 19, Injuries. Number 3, Chapter 20, External Causes. And number 4, Chapter 21, Health Status Guidelines, all for ICD-10-CM Section 1. Don't forget to follow along in your MCG manual. Go ahead and flip to Chapter 18. I think this is the best way to follow along. The guidelines are laid out a little nicer because you have the sequencing order. However, if you don't have the MCG manual, go ahead and use the official ICD-10-CM guidelines published by CMS. The link is in the chat. It's also outlined in order. However, the sequencing order is not there, but this is a good time to write it down. All right, let's go ahead and let's get started on Chapter 18, Signs and Symptoms. All right, coders, welcome to Chapter 18 of ICD-10-CM. we dive into coding signs and symptoms and abnormal findings that do not have a confirmed diagnosis. You all have studied this, right? The signs and symptom guidelines are actually the general coding guidelines, right? These signs and symptom guidelines are also found in section 4, which we've reviewed in week 1 of this course, right? So again, we know what this is. These are things like fever, chest pain, nausea, abnormal blood test. So these are signs and symptoms that do not have a confirmed diagnosis. So let's go ahead and talk about some key FTRs that you should know or be aware of when coding for Chapter 18. Number one, coders. Did you know that a sign is what the physician can observe? Yeah, think of a stop sign. We'll let that marinate. Number two, a symptom is what the patient feels. Yeah, so only the patient can provide a symptom, and a physician typically provides the sign. And signs and symptoms are indicators of a diagnosis. And when you have signs and symptoms integral to a diagnosis, you do not code them separately. Don't code those signs and symptoms unless there is a guideline that says otherwise, or a guideline that says there are manifestations that you need to code. Okay, coders, that's just about it. Now it's time to go ahead and solve Chapter 18 scenarios. Now, what do? We inventory, select the first listed code, apply all guidelines, and coders, don't forget to trust the guidelines. And on that note, I'm going to ask Miss Bianca to take it away, please and thank you.
Thank you, Miss J. Okay, coders, let's start with our first question. What is the best code for this encounter? A, R07.9, B, I20.9, R07.9, C, R07.9, R06.02, R42, or D, I51.9. Mr. Anderson, a 54-year-old executive, presents to the ED at midnight with sudden onset chest pain radiating to his left arm, shortness of breath, and pronounced dizziness. Despite a thorough workup, including EKG, cardiac enzymes, chest x ray, and stress tests, no definitive diagnosis is established. The emergency physician documents chest pain under investigation, possible cardiac origin, continue outpatient workup. You all have 3.5 minutes. Okay, let's start with our inventory list. And I put on mine chest pain, or sudden onset of chest pain, radiating to his left arm, shortness of breath, pronounced dizziness, no definitive diagnosis. The guideline that I used to help me solve the scenario was Chapter 18A, and this guideline tells us that we use the use of symptom codes. So we can assign first, signs and symptoms, as long as they're not integral to a definitive diagnosis. So yes, okay, so let's move on. Okay, so I have our little cutout from our guideline over here. I have a small inventory list over here, and let's go on to solving the scenario. So since we have no definitive diagnosis as listed as number 5 on our inventory list, and it's just a possible cardiac origin, I'm going to eliminate our I codes just based off of that because I know it's not going to be in that chapter. So I'm going to eliminate B and D. And now let's take a look at these R codes. So we have R07.9, which is chest pain unspecified, which we do have here. So we are going to keep that code. And we also have R42, which is dizziness and giddiness. And we have pronounced dizziness listed on our inventory list. So we will keep that as well. And R06.02, which is shortness of breath, which we also have listed as number 3 on our inventory list. And so we are going to keep that as well. And so all these 3 things is what our patient was presented with. So we need to make sure we're documenting all of these since we don't have a definitive diagnosis. So that tells me that we can eliminate A because it's only coding for the chest pain. So this is going to leave us with our answer as C, R07.9, R06.02, R42. All right, coders, let's move on to the next one. What are the best ICD-10-CM codes for this encounter? A, G35, B, R25.3, G35, C, G35, R25.3, D, G35, R25.3, G51.8. Sarah Johnson, a 35-year-old patient with confirmed multiple sclerosis for 5 years, presents to her neurologist with facial twitching that began 2 weeks ago. The facial twitching is a new symptom that has not yet been evaluated. Initial examination shows intermittent facial muscle contraction. The neurologist documents new onset, facial twitching, etiology unknown at this time. We'll order MRI to evaluate. All right, coders, you have 3.5 minutes. Okay, let's start with our inventory list. And I have multiple sclerosis, facial twitching with etiology unknown. And the guideline that I used to help me solve this scenario was Chapter 18B. And this tells us that if you have a symptom code with a definitive diagnosis, you'll code first the definitive diagnosis and second any signs and symptoms that are unrelated to the definitive diagnosis. Okay, so let's take a look at our codes here. So we have G51.3 subcategory, which is clonic hemifacial spasms. The one we have listed here is G51.8, other disorders of facial nerve. We don't have anything stating that this is a disorder of a facial nerve, so we are going to eliminate this and eliminate D. Let's take a look at G35, multiple sclerosis, which we do have documented, so we are going to keep this. But our encounter isn't just, for multiple sclerosis. We have this facial twitching going on. So I'm going to eliminate A because this is just coding for multiple sclerosis. And now let's take a look at these R codes. So we have R25 category, which is abnormal involuntary movements. And then the ones we have listed in our options is R25.3, which is fasciculation, twitching not otherwise specified, which is more in line with our encounter. And if you do look up facial twitching in the index, it will point you to this code. So we are going to keep this code here. And so now we have B and C. And as you can see here, it's based off of sequencing order. So what is the reason for our encounter? This patient who already has multiple sclerosis that's been diagnosed for quite a while is presenting with facial twitching, new facial twitching. So their reason for the encounter is going to be that facial twitching. So I'm going to sequence the facial twitching first, the R25.3, and then the multiple sclerosis second. So we're going to eliminate C, keep B, R25.3, G35. All right, coders, I hope you guys all got that correct. And I will be handing you back off to the wonderful Miss J. See you all next week.
Now that you've worked through chapter 18 with signs and symptoms, by the way, thank you so much, Miss Bianca. Let's talk about chapter 19, injuries, poisonings, and certain other consequences of external causes. Well, what is it? Well, chapter 19 is where we focus on those injuries. In fact, I said there were four sections of guidelines that we're going to work through: fractures, poisonings, and burns, not in that order. All right. So, without further ado, coders, let's go ahead and turn our attention to the first type of injury: fractures. Let's just quickly define what a fracture is. And it's pretty much a break, crack, or disruption in a bone that occurs when that bone is subject to more force than it can handle or absorb. And on your screen, you can see different types of fracture. And these fractures can result from trauma, such as a fall or an accident, or repetitive stress, overuse. So, particularly in chapter 19, we are dealing with acute fractures, meaning that they happened right now, that it occurred typically due to the former as opposed to the latter. All right, coders, let's go ahead and let's take a look at these FTRs. All right, so when coding chapter 9, fracture, number 1 FTR, always assign the seventh character the fracture codes. Yeah, so chapter 19 have seventh character extenders. All right. So typically it's going to be an A for initial or active treatment, D for subsequent encounter, S sequela. Now, coders, there are many more than these three, but these are the most common three. You're going to learn about some of those seventh character extenders. Number two, when you have multiple fractures, you're going to code the most severe fracture first and code them accordingly, the most severe to the least severe. FTR number three, when you have opened and closed fractures, if the documentation doesn't specify if it's open or closed, your default will be closed. Number four, when you have a malunion or non-union fracture, this is not necessarily a fracture. This is um, the fracture after it's healed or should have been healed. So this is the result. Malunion means poorly healed or badly healed. Non-union means it didn't heal. So make sure you pay attention to the appropriate seventh character extender. FTR number four. Okay, number five. Laterality matters. So always choose the code that correctly identifies left, right, or unspecified. And coders, you know what? That's a gimme. You know right is one and left is two. And knowing that on site, you can eliminate some wrong answers. All right, it's time to solve chapter 19 scenarios. But first, let's review how to solve an ICD-10-CM scenario the AMCI way. Number one, you're going to inventory. Number two, you're going to select your first listed code. Three, apply all guidelines. All right, Ms. Dolly, take it away.
Hello, coders. I hope you're doing well. Here is question number one. Of the following answers, which best describes the encounter? A. S93.401A. B. S93.401D. C. S93.401S. Or D. S93.409A. A 30-year-old woman is evaluated in urgent care for a right ankle sprain sustained while hiking. She was initially treated at another facility 3 days ago with an ACE wrap and crutches. Today, the provider performs a re-examination, provides instructions on gradual weight bearing, and refers her to physical therapy. The provider is seeing the patient for the first time, but no new injury has occurred. Of the following answers, which best describes the encounter? Okay, your time will begin now. Good luck.
Okay, coders, what say you? What are your key words? Let's see if you and I have the same or similar. All right, so my first is right ankle sprain. If you wanted to put urgent care, you can. Number two, she was treated with ACE wrap and crutches 3 days ago at a different facility, and this is active treatment. I know that's not there, but this is a learning moment. This is a teachable moment and a learning moment. All right, so this is active treatment. This is the active phase 3 days ago. But today, the patient's here for a re-examination of the same injury, also instructions on weight bearing, and a referral for physical therapy. Okay, coders, I know we probably don't have the same, but just let this marinate just a little bit. All right, so what is the first listed code? If you said right ankle sprain, way to go. Now let's turn our attention to to the answers and notice that the seventh character extenders are sort of different. Two are the same, but the others are different. So I believe that when you have this type of situation with seventh character extenders where the majority are different, then that is primarily what's going to determine the code selection. So we have to select the correct seventh character extender. That's my guess. All right, now let's go ahead and solve. Which ICD-10-CM guideline do we have to reference? Well, I like C19A. Here's why. Because this is the guideline that tells you about the application of seventh character extenders. And right away, we should just get rid of that S because S is the seventh character extender for a sequela, for an injury that is a residual effect of another injury, of an injury that occurred in an acute phase. So if you have a sprained ankle, the residual effect or the sequela won't be the sprained ankle. We've learned that, right? It'll be something else, maybe arthritis, etc. So we can get rid of C on the strength of that seventh character extender S. Now, was there active treatment today? That is what we have to answer, right? So, and also too, whenever you have these scenarios, your focus should be today. What am I coding for today, right? So, was there active treatment today? So let's go ahead and look at the definition of active treatment. This is the code for an initial encounter, and it's used for each encounter where the patient is receiving active treatment for the condition. Now, I still didn't define what active treatment is, but let's take a look over here. Active treatment can be defined as surgical treatment, emergency department evaluation. So if you put urgent care here, whenever they're in the urgent care, that would answer this, you know, um, definition. Also, continuing treatment by the same or different provider. Maybe we should be a little more specific. Continuing active treatment by the same or different provider. So this seventh character extender definition has a red box around it because it's not, it's saying that this is not active treatment, right? This patient just had a re-examination, instructions, and physical therapy. But if we look at subsequent encounter seventh character D definition, this is used for encounters after the patient has completed the active treatment of the condition and is receiving routine care for the condition during the healing phase. Okay, coders, this sounds like we are in the subsequent encounter phase or the healing phase. And here are some examples of seventh character D encounters: cast, change, or removal, X-rays to assess healing status of a bone injury, removal of internal external fixation devices, medication adjustments, and other such as follow-up visits for routine care and referrals. So I know that this injury happened 3 days ago. They had the active treatment 3 days ago, and we are now in the healing phase and should use seventh character D for subsequent encounter. So I would say that this indeed is subsequent encounter D, and B would be our answer because remember, this encounter is not based on whether the provider is seeing the patient for the first time. This patient was already seen 3 days ago and already actively treated. Now, let's go ahead and do our due diligence and look up our code. All right, so S93, dislocation and sprain of joints and ligaments at ankle, foot, and toe level. This is the correct boss or category, but definitely turn your attention to the seventh character extender box. Now let's look up our code. S394, sprain of ankle. We've got two different codes here in our answer. We have 401 and 409. And if we look at 409, this is sprain of unspecified ligament of unspecified ankle. All right, coders, our ankle is specified, right? Yeah, it's the right ankle. So this is incorrect, and the correct answer will be S93.401, sprain of unspecified ligament of right ankle. Now all we have to do is select A or B, and it's based on the seventh character extender. We've already established that the subsequent encounter D extender is applicable, and the answer is B. Okay, coders, how do you feel? So, a lot of you probably got this correct, and that is outstanding. And some of you may have aha moments, and even if you got it correct, you still may have had an aha moment. So, I hope you did. And now we have another scenario. Of the following answers, which best describes the encounter? A. S42.302A, B. S42.302D, C. S42.302P, and D. S42.302S. A 72-year-old man is seen in the orthopedic clinic for continued pain in his left humerus following a fracture sustained 5 months ago. Imaging reveals a malunion of the mid-shaft humerus, and the provider documents that the bone healed improperly. The patient had previously undergone casting and physical therapy but continues to have limited range of motion. Today's visit is a part of his ongoing care for the malunion. Okay, coders, your time begins now. How did you do, coders? This is another scenario where the seventh character extenders are different, but I think this is a little more straightforward with a little bit of context. This is going to be an aha moment for some of you. All right, these are my keywords. Pain in the left humerus, fracture sustained 5 months ago, and this is a malunion. The imaging reveals that a malunion of the mid shaft of humerus is present. So this patient has a malunion fracture. And what is that? We're going to learn in a moment. But again, coders, these seventh character extenders are different, and this will determine our answer. So if I were to say of the three, which is our first listed code, I'm going to say malunion of midshaft of humerus. Yes. Now, let's go ahead and solve with our guideline. All right, so the guideline that we're going to use is C19C1. Yes, this guideline talks about subsequent encounters for fractures, right? So, the first guidance I want you to pay attention to in the third column is paying attention to the reference box at the category code level, basically your seventh character extenders, and also malunions and non-unions. But this scenario is pertinent to malunions, and that means poorly healed, and your seventh character extenders will be a P, a Q, or an R. So with that said, coders, what's the correct answer? You can just look and see. It should be C. All right. Our third column of our guideline is here. We've just kind of shortened it so you can just focus on that. And here's our boss, our category, S42, fracture of shoulder and upper arm. And notice the notes. Notes are also guidelines, specific coding guidelines. A fracture not indicated as displaced or non-displaced guideline. A fracture coded as not indicated as opened or closed guideline right here. And also you see your excludes one and excludes two notes and definitions. This is the Optum manual, ICD-10-CM, so we do have definitions in it, and other publications probably do as well. And also, don't forget the seventh character extender box is here. And it's important that you read the definitions because they are not the same. A is initial counter for closed fracture, but B, this is an initial counter for open fracture. Also, but D is the same. Subsequent for routine healing. G is subsequent for delayed healing. K is subsequent encounter for fracture with non-union. But P is a subsequent encounter fracture for malunion. And S, this is a encounter for a sequela, and we've learned what sequelas are, right? The residual effect. Okay, coders, so let's look at our code. S42.302. All of the answers share the same code. So this is the code for unspecified fracture of shaft of humerus, left arm. And now we'll have to focus our attention on the seventh character. Okay, coders, let's go ahead and eliminate A because this is the seventh character extender for initial encounter for closed fracture, the active treatment. This is not active treatment. Remember, this is a malunion. So A's got to go. We're also going to eliminate D because this is not a subsequent encounter for fracture with routine healing. No, not our case. We have a malunion. In fact, this seventh character extender actually specifies the fracture. So when you see malunion in your documentation, likely you have to use the seventh character extender for that malunion. Okay, hopefully that's an aha for some of you. Now we're going to also get rid of S because S is coding for the sequela. We're not coding for a sequela today. No, our documentation specifically says this is a malunion, so therefore we are going to use seventh character extender P, subsequent encounter for fracture with malunion. So we're going to eliminate A, B, D, and our answer is going to be C. Okay, coders. So the moral of this story, if your documentation says malunion, and we know what a malunion is, poorly healed or badly healed. If it says non-union, you're going to use the non-union code. And sequela, you're going to have to determine if it's a sequela if we are treating the residual effect. Okay, coders, how are you doing? Okay. Let me know in the chat. I am here and I am waiting for your questions. Okay, now we're going to turn our attention to burns. And what is a burn? A burn is an injury to the skin or the deeper tissues, and this type of injury is caused by heat, flames, electricity, radiation, or friction. Yes. And not only are we coding for burns in this section, we're coding for corrosions. And what is a corrosion? A corrosion is a tissue injury caused by contact with a chemical substance. Yeah. So, unlike burns caused by heat or electricity, etc., corrosions specifically involve chemical destruction of the skin and the underlying tissues. So, let's go ahead and review some FTRs when coding burns and corrosions. FTR number 1. Always code burns by the site, that's the location on the body, the depth, and the extent. We'll talk about what those are a little later as we're solving these scenarios. Number 2, sequence the most severe. You know, third degree is the most severe. Number 3, don't code multiple burns at the same anatomical site separately. Number 4, when coding burns and corrosions, don't confuse the two. And 5, when available, use external causes codes. Those are codes from Chapter 20. You're not going to see any in this section, but you will learn how to use them in Chapter 20. These external causes codes, they describe how the burn happened. And that's important, right? Okay, now it's time to solve our first burn scenario. But first, let's review how to solve an ICD-10-CM scenario the AMCI way. Number 1, you're going to inventory. Number 2, you're going to select your first listed code. 3, apply all guidelines. All right, Ms. Dolly, take it away. Of the following, which answer best describes the encounter? A. T22.331A, T21.33XA, T32.11B, T21.33XA, T22.331A, T31.11C, T22.339A, T22.34XA, T32.11D, T21.331A, T21.34XA, and T31.11. A 34-year-old patient is admitted with severe burns from a house fire. The provider documents third-degree burns covering 22% of total body surface area on the upper posterior trunk, 15%, and right arm, 7%. Okay, coders, your time begins now. How did you do, coders? All right, we'll see. We will see. I know you did your best, and that is enough. Okay, what were your key words? Mine are severe burns, house fire, third degree burns, upper posterior trunk, 15%, third degree burns, right arm, 7%, and total body surface area, 22% or third degree. Now, how do you know what to document, Mrs. J? Well, I'll tell you this, coders. I've coded a lot of burns, right? And so I kind of know the guideline. I kind of know what you need to sequence first, second, and third. So I do have an advantage, but you know what, coders? You're going to learn this too. Ultimately, ultimately. But remember, you have to take baby steps, right? Okay. Now, what will be the first listed code? If you said the third degree burns, that's right. Third degree, basically we only have third degree burns, but if you had all three, you're going to sequence your more severe first, and third degree will be first listed, followed by second and first. Now, let's go ahead and let's look at these guidelines. So the guideline that we're going to reference is C19D1, And here is why. This is the guidance for sequencing of burns and related conditions. This is what I've come to learn, after seeing it repeatedly. Of course, it's going to stick. So you're going to sequence first your third degree burn. And remember, third degree burns are of the most severe. Then you have second degree burns, that's next. Third degree burns will be, your third sequence will be first degree burns. And fourth will be your extent of body surface area or total body surface area. So this is the total amount of body burned, and then they ask you to specify the percent of the third degree also. So those codes that you select will um, require that you know the total amount burned, as well as the total amount that are third degree. If that makes sense. It might make sense, it might make better sense when you see it written. And finally, the extent cause codes, or these are the who, the what, the how it happened. Not who, but what, how, and when, I guess. All right, so let's go ahead and let's look up our codes. T22.33, T21.33, T32.2, and T31.2. All right, I like T22.331. This is the code for burn of third degree of right upper arm. I like it. What I don't like is T22.339. This is burn of third degree of unspecified upper arm. Well, we know this is the right arm, right? So it is specified, and therefore we can eliminate C because C is coding for an unspecified arm. Got to get rid of it. Now, if we go down to the T21.33 subcategory, you've got burn of third degree of upper back. And you also have T21.34. This is of the lower back. I like the upper back and not the lower back because our third degree burns of the upper posterior, which means back side of the trunk. So upper back of the trunk. So therefore, we're going to eliminate any answer that's sequencing T21.34, and you see it right here, D. Got to get rid of it. Now, let's look at A and B. What's the difference? Well, there are two things that are different. Number one, the sequencing of the arm and the back. A is sequencing the arm first, and B is sequencing the back first. And also, the EBSA, or the total body surface area codes, are different. And you know what, coders? I got to tell you, on site, I know which one is correct. And this is just a little tip. Of course, you're supposed to sequence the most complex. So the most complex, of course, is third degree. And also, look, your posterior upper trunk is 15%. You've got more back than your arm. So you should sequence the most first because it's more complex, right? So I'm going to sequence that T21.33 first, and then I'm going to sequence my arm second. Now let's take a look at these codes. All right, we've got T21.21. This is a corrosion involving 20 to 29% of the body surface with 19% of it being third degree. That's not going to work. But we've got T31.22. This is burns involving 20 to 29%, right? We've got 22% with 20 to 29% being third degree. That is the case because both of these total equals 22%, and our total body surface area code will be T31.22. And our answer, coders, our answer is B. It's sequencing properly and it has the correct EBSA number or code, and that's our answer. So we're going to eliminate A and we're going to select B. And if you said B, coders, outstanding. Of the following answers, which best describes the encounter? A. T24.311A, T24.211A, T22.211A, B. T22.211A, T24.311A, T24.211A, C. T24.311A, T22.399A, and D. T24.311A, T24.211A. A 25-year-old male presents to the ED after a bonfire accident, resulting in burns to his right forearm and right thigh. The right arm has second-degree burns, while the right thigh has both second and third-degree burns. Okay, coders, your time begins now. How did you do, coders? Did you select the correct guideline? Was there a guideline that helped you answer this question? I hope so. All right, here are my key terms. I did indicate that this is an ED. Bonfire, burn of right forearm second degree, and burn of right thigh second and third degree. And this patient had debridement. Even though, and this is a surgical procedure, even though this is a surgical procedure, there are no surgical procedures in our answer, but I still documented it anyway. Now, coders, just want to remind you what first, second, and third degree burns look like. This is first degree. It's more on the epidermis, the the outer layer, most outer layer of the skin. That's where the burn is pretty much, um, it's in that location. And your second degree burns can involve your epidermis and your dermis. And third degree burns, wow, they can go all the way down to your subcutaneous level and beyond. All right, coders, just thought I would tell you that. Also, too, I want you to just kind of get familiar and get comfortable seeing codes, the degree on site. So if you look at A, in this fourth character space, this tells you this is third degree. In B, you can see it's second degree. Second, third, third, second. Just thought I would give you that. Now let's go solve. All right, let's do it. And the guidelines that I'm going to use, yes, guidelines, C19D1 and C19D2. D1, of course, is the sequencing order. So if I'm always referencing it, it sticks, right? So we know sequencing order, we've just reviewed it. But the C19D2, this guideline is for when you have burns of the same anatomical site. When you do, you only code the highest degree. So if you have second and third degree burns of the thigh, same anatomical site, you're only going to code the third degree. I'm going to let that marinate for just a moment. And now let's go ahead and let's look up our codes. And we're going to begin with A, T24.311. And we said earlier you can recognize this 311 as third degree, right? So yes, it's third degree burn of right thigh. I like it, right? We've got a third degree burn of the right thigh. We do. And T24.211A is second degree burn of right thigh. I don't like that at B. We should never sequence the second degree before the third. So let's go ahead and get rid of B. Now, let's take a look at our next code, T22.211. This is the code for second degree burn of right forearm. That is a good code, right? And you find that at A and D. But what is not a good code is at C, that T22.399 over here. This is burn of third degree of multiple sites of unspecified shoulder and upper limb. Wrong degree, wrong location. So therefore, the answer is wrong. Let's get rid of C. And that leaves us with A and D. And then that brings us back to our guideline, right? Our guideline says when you have burns of the same anatomical site, only code the highest degree. So A is wrong because it's coding both third degree of the thigh and second degree of the thigh. It should only code for third degree. So let's go ahead and get rid of A. And D is our answer, coding for third degree burns of the right thigh and second degree burns of the right forearm. And if you said D, coders, outstanding, outstanding. And if you had an aha moment, let me know. Go ahead, talk to me. Talk to me in the chat. And if you did have an aha moment, that is priceless. Okay, now we're going to switch gears and we're going to talk about adverse effects and poisonings. All right, coders, you've nailed the burns. Now it's time to take a look at adverse effects and poisonings. So, what is it, coders? Well, an adverse effect is when a drug was prescribed and it was properly taken and the patient had a reaction. A poisoning is any improper use of a drug. Okay, you know I like to simplify things, right? Yeah, so that's pretty much what it is. Now let's go and take a look at those FTRs, those Chapter 19 adverse effects, poisonings, FTRs. And the FTRs are just what I've said. There's not too much more, but it is important that you understand the difference. And the key terms in poisoning and adverse effects, once you nail them, you're going to be able to recognize them very quickly. All right, so FTR number one, when coding a poisoning, the substance was taken incorrectly or improperly, whether accidentally, intentional, or for assault purposes, that is a poisoning. And how you locate it, if you're not taking a multiple choice exam, you go directly to the table of drugs and chemicals, and we'll review how to do that, during our practice exercises. FTR number two, an adverse effect is when the medication was properly prescribed and taken correctly, but the patient had a bad reaction. Now, coders, just want to let you know the main key word for adverse effect is prescribed. It should have been prescribed. The doctor's got to prescribe it, and the patient has to take it correctly. And that's how you know it's an adverse effect. Now, FTR number three, when coding poisoning or adverse effects, never assign codes for abuse, dependence, etc., unless the provider documents it. And that's it. Okay, coders. It's time for our scenario. But first, let's review how to solve an ICD-10-CM scenario the AMCI way. Number one, you're going to inventory. Number two, you're going to select your first listed code. Three, apply all guidelines. All right, Ms. Dolly, take it away. Of the following, which best describes the encounter? A. R11.10, T54.3X1A, R07.0, B. T54.3X1A, R07.0, R11.10, C. R07.0, T54.3X1A, R11.10, D. T54.3X4A, R07.0, R11.10. A patient presents to the ED after accidentally ingesting bleach, sodium hypochlorite, while it was stored in a water bottle. The patient is experiencing severe throat burning and vomiting. The provider documents toxic effect of caustic substance. Okay, coders, your time begins now. All right, coders, how did you do? Were you able to get those keywords? I know it. I know you did. Your inventory should look something like this, but just so you know, sometimes it's subjective. But when you are coding for these um, adverse effects and poisonings, this is basically a good way to inventory. So number one, let's just go down our list. I did document emergency department because sometimes it's significant. Um, Sometimes it impacts your code selection. I'll show you why in a minute. So, ED, accidentally ingesting bleach, right? And then I wrote down the chemical name or the scientific term, sodium hypochlorite. Then severe throat burning and vomiting. And then the provider documented toxic effect of caustic substance. I jotted that down too. Now, you coders will need to determine, is this a poisoning or is it an adverse effect? So, we know that the provider said that this is a toxic effect of caustic substance, but is that a poisoning or an adverse effect? This is how you'll be able to determine if it's a poisoning or adverse effect. The table of drugs and chemicals. Yes, this table of drugs and chemicals is found in the alphabetic index right after the neoplasms table. And the chart is classified according to chemicals in alphabetic order. So I've chosen to look up the chemical name of bleach because it was provided, and this is a table of drugs and chemicals, right? So you can find drugs here, you can find chemicals. Um, so the chemical name is sodium hypochlorite. So you look up sodium and then you scroll down until you find hypochlorite. And right next to it, it says bleach, not elsewhere classifiable. And let me get rid of my pointer. And boom, you've got four options, right? So if you look at the top of the columns, the columns, subsequent columns, you'll see the first one is poisoning accidental, intentional. The second is poisoning intentional, self-harm. I think I want to eliminate this self-harm right away because there's no mention in the documentation that um, the patient's intent was to harm themselves. That wasn't mentioned, so we're not going to even include this column. Poisoning, assault, there is also no mention that an assault took place. So I'm going to get rid of this as well. Poisoning, undetermined. I'm not going to say it's undetermined because the patient said that they accidentally ingested bleach. So we're going to get rid of this column too. And then adverse effect, we mentioned earlier what adverse effect is. That means that it was properly prescribed. No physician prescribed bleach. So we're not even going to consider it. And also, too, look, there's not even an option here. So I think the best option is this poisoning accidental. We know this is it because the patient says they accidentally ingested the bleach, so T54.3X1 should be our answer. And if you look at the answer selections, B is the only one sequencing for that. And you know what, coders? If you're taking a multiple choice exam, you've just got your answer on site. But often um, you may not be looking up your code in the index. No, because when you're testing, we tell you to go straight to the tabular list. So let's assume that we went to the tabular list. But first, let's go ahead and grab our guideline. And guideline C19E5B does it for me because this is the guideline for poisonings. We know it's a poisoning because we've determined that in the index, right? Okay, so when you have a poisoning, you're going to sequence first your T code, followed by your manifestations. Basically, what happened, right? What are your diagnoses that result from this poisoning? All right, so if we are going to follow this guidance and trust this guidance, then we're going to trust the sequencing order. And if you look at our answers, we can eliminate some things right away. We can eliminate anything that's not sequencing that T code first, right? So we're going to get rid of A and C. They are distractions. And now we can focus our attention on B and D. So let's go ahead to the tabular list and look up our codes. Okay, so if we see T543X, 3X1, this is the code for toxic effects of corrosive alkalis and alkali-like substances, accidental, meaning it was unintentional. That's our code. And T54.3 X4, this is toxic effect of corrosive alkalis and alkali-like substances. However, this is undetermined. We already established that this is determined to be an accident, so T54.3X4 is incorrect. Now let's continue and do our due diligence. We've got pain in the throat, R0 7.0, and vomiting, R11.10. Now, coders, I mentioned earlier that, hey, the way we document or inventory is a little different when you're coding for poisonings and adverse effects. And the reason is, as you can see here, these signs and symptoms are often the manifestations, or they can be, right? So typically, after a person has a poisoning or an adverse effect, they don't typically have a diagnosis, right? No. So often you'll be coding these signs and symptoms as your manifestation. So if we look at our answers, D is incorrect because it's coding for undetermined. And B, well, that's correct because it is coding for that accident. And coders, if you said B, outstanding. But if you've learned something, that is priceless. It is. Okay, we've got one more. Let's do it. Of the following answers, which best describes the encounter? A. T36.0x5A, R19.7, E86.0, B. R19.7, E86.0, T36.010X1A, C. E86.0 or 0, R19.7, T36.0x5A, and D, T36.0x1A, R19.7, E86.0. A patient is brought to the emergency department for evaluation of severe diarrhea and signs of dehydration. The provider conducts a thorough assessment and determines the symptoms result from amoxicillin, which was prescribed to treat strep throat. The patient reports that the diarrhea began shortly after starting the medication. He confirms that he's been taking the medication exactly as prescribed. Okay, coders, your time begins now. How did you do, coders? How did you do with that inventory? Did you write down ED, diarrhea, dehydration, prescribed amoxicillin, strep throat, and properly administered? Did you? Might be something like this. Hopefully you did. So I just want to affirm that these adverse effects and poisonings often have signs and symptoms that you code for. So your inventory list is going to look a little different. Also, maybe I wouldn't put strep throat on there, right? Yeah, because the patient's not being treated for it. So maybe I would eliminate that. So, your task coders, you need to know or determine if this is a poisoning or an adverse effect, right? So, do you know which one it is? All right, coders. Well, let me give you a hint. If it was properly prescribed and administered or taken, then it's an adverse effect. Was it properly prescribed? Well, yeah. We can just assume, this is one of the few things we can assume, that when a patient has a prescription, it says it was prescribed, that it was proper. Okay? And the patient affirms that he's been taking the medication exactly as prescribed. So it was properly administered or properly taken. This is an adverse effect. All right, coders. So let's just go ahead and look this up on the chart, the drugs and chemicals chart, just so you can see it. So essentially, like we said before, this is in alphabetical order. So go to the A's and scroll down until you find that drug. And our drug is amoxicillin. And we've already determined this is an adverse effect. So there's no point in looking at the other columns. So if we go to the adverse effects column and go down until you hit the amoxicillin, you'll see the code sitting right there, T36.0X5. All right, coders, we can eliminate some things just based on that. But if you're taking the exam, you got to go right to the tabular list because you have to go anyway. So I still recommend that you bypass this step. But some of us are learning, so let's go ahead and show you how to do both ways. Now we're going to the tabular. But first, we're going to reference our guideline C19E5. And this is the guideline for adverse effect. And the guideline says that you're going to sequence this the following way. Number one, you're going to put your adverse effect first, or your manifestation, or your diagnoses. You're going to sequence them before your T code. And if that is the case, coders, let's go ahead and eliminate some things on site. I like to do that with these. See the A and D, they're not sequencing the manifestations first. Only B and C are, so we're going to get rid of A and D. And there's something else. You got a little tip, coders. Right here, when you have an adverse effect, your fifth or sixth character is a 5. Yes. So on site, if you look at B and C, let's look at our adverse effect code. Look at that. B's sixth character is a 1 and C is a 5. And you know what, coders? That's our answer, C. Now, coders, if you knew this guideline, and this is the one that I want you to remember, if you remember adverse effect, coders, you will love these poisonings and adverse effects. Number one, and I'm saying only remember adverse effect. Remember the sequencing, that you're going to sequence your manifestations first or your adverse effect first, it followed by the T code. And second, remember that that fifth or sixth character has a 5 in it. That's just a tip that I want you to have. You can apply it when poisoning is the answer, because you can rest assured that adverse effect code will be one of the answers you get to eliminate. So you can eliminate it on site. Just saying. Now let's go ahead and look up our codes. If we look up T360X, this is poisoning by adverse effect of and underdosing of penicillins. And T36.0X1 is going to come up incorrect because this is a poisoning code, an accidental poisoning. It's wrong. And if we look at T36.0X5, look at that X5 adverse effect of penicillins. And yes, amoxicillin is in the penicillin family. And if we continue to do our due diligence, R19.7 is your diarrhea code, and E86.0 is your dehydration code. So C is sequencing dehydration, diarrhea, and the adverse effect, and is correctly sequencing according to the adverse effect guideline. So let's go ahead and get rid of B, and C is our answer. And coders, if you've learned something, that is priceless. That's it. Now we're going to switch gears with our next topic. All right, coders, we made it to chapter 20. You all nailed those in chapter 19 guidelines. Yeah, it's pretty much sectioned up quite a bit, and you all did an amazing job. Okay, so in chapter 20, this is where we capture the how and the where behind injuries, poisonings, and other adverse events. Now, these are called external causes of morbidity, and they provide us more details about that injury, such as a fall. If someone falls, you might get more information about how they fell or where they fell. How did you fall? Maybe a slippery floor. Where? In the kitchen. So it provides more context about an injury. Yeah, that's what it does. So let's just think of chapter 20 as a way to paint a full picture of the patient's experience. So these are not mandatory. However, these codes add more laterality. No, we're not going to call it laterality, excuse me. It's not laterality. What is the word I'm looking for? Okay, coders, in the chat, tell me what is the word I'm looking for. And when I get finished with these FTRs, I will have remembered and I'll let you know. Okay, coders, FTR number one, external causes. Cause codes are always secondary codes. Never ever sequence them first. FTR number two, use as many external cause codes as necessary to explain the circumstances. FTR number three, the intent of the event matters. So, what was the intent? Was it an accident, assault, or intentional self harm? Number four, place of occurrence. This identifies where the event happened. FTR number five, activity codes, describes what the person was doing at the time of the injury. And finally, FTR number six, external cause codes are not mandatory unless specifically required by a payer. but it is good to indicate them, right? Because it makes it more granular. That was the word I was looking for. Granular. Okay, coders, if you knew that word, outstanding. Okay, it's time for our scenarios. But first, let's talk about how to solve an ICD-10-CM scenario the AMCI way. Number one, inventory. Two, select the first listed code. Number three, apply guidelines. Trust those guidelines. And take it away, Mr. Sandeep, please and thank you.
Thank you, Mrs. J. Okay, coders. Now let's do the first scenario from external cause coding. And here is your first question. Of the following answers, which best describes the external cause of the encounter? Your options are option A, W18.49XA, Y92.61, Y93.H3, Y99.0. Option B, W11.XXXA, Y92.62, Y93.H3, Y99.8. Option C, W13.4XXA, Y92.61, Y93.H3, Y99.0. And option D is W13.2XXA, Y92.9, Y93.H3, Y99.9. A 32-year-old male construction worker is brought to the emergency department after falling through the window of building under construction at his job site. He sustained a closed fracture of left humerus. Provider confirms it was an accidental fall that occurred during the work hours. The patient was actively engaged in his duties at the time of incident. No drug, alcohol, or other contributed to the event. Of the following, which best describes this external cause of the encounter? And coders, you got 2 minutes to solve the scenario, and your time begins now. And that is time. Let's have a look into our inventory. Construction worker falling through window, building under construction, closed fracture of the left humerus, and he was actively engaged in his job duties at the time of the incident. So, guideline C20A3 states that use full range of external cause codes. Yes, so use the chapter 20 codes to fully describe the circumstance of the injury. And first, let's look into the cause. What caused the illness or injury? Patient in our scenario fell through the window. So let's go and look into the options. W18.49 is coding for others slipping, tripping, and stumbling without falling. So in our scenario, patient fell through the window. So option A is incorrect. Option B is coding for W11.XXXA, which is for fall on and from ladder, which didn't happen in our scenario. Option B is incorrect. Option D, coding for W13.2, is for fall from or out of or through the roof. So we had a falling through the window and not through the roof. So option D is incorrect as well. And we have arrived at the correct answer, by the way. That would be W13.4XXA, which is for fall from or out of or through the window. So we are already arrived at the correct answer, but still, let's go ahead and look into the other ICD codes. And after we got the external cause codes, we have to identify the place of occurrence. Yes, and the guideline C20P states that the code from category Y92 is used for place of occurrence of the external cause and are secondary codes for use after the external cause codes to identify the location of the patient at the time of injury and other condition. So in our scenario, where did the injury happen? Where was the patient when he fell through the window? Yes, he was in a building under construction. And Y92.61 is coding for building under construction as the place of occurrence of external cause. So yes, Y92.61 is the correct answer. And next, let's look into the activity code. So guideline C20C states that assign a code from category Y93 for activity code to describe the activity of the patient at the time of injury or health condition occurred. So in our scenario, patient was doing his job and he is a construction worker and he was doing his job duties at the time of the incident. So activity is going to be Y93.H3, which is building and construction. And finally, we also have to look into the external core status. So a code from category Y99 external cause status should be assigned whenever any other external cause code is assigned for an encounter, including the activity code. So let's go ahead and look into Y99.0. It is coding for civilian activity done for income or pay. And that is also a correct code selection. So the correct answer is going to be option C. Now that we have arrived at the correct answer, let me show you how to search for these codes in your ICD-10-CM manual. So you can search for these codes in the external cause index. So we had a fall through the window as an external cause. So you have to go and search for fall, and under that you have to go to out of window. That would lead you to W13.4. And coders, you cannot stop at this step. You have to go and verify these codes in your tabular list. So go and search for W13.4 in your tabular list and you will find that This is an incomplete code and you need seventh character. So assign your seventh character accordingly. And in our scenario, we had an initial encounter. So the seventh character is going to be A. The correct answer would be W13.4 XXA. Next, we have to look into the place of occurrence. So what was the patient when the injury occurred? And he was in a building under construction. So under the place of occurrence, go and search for building under construction, and that would lead you to Y92.61. You can verify the code in your tabular list, which would give you building under construction as place of external cause. Next comes the activity. Go to the activity and search for construction building, and that would lead you to Y93.H3, which is for activity, building, and construction. Lastly, let's go ahead and search for the status of external cause. So the status of external cause is going to be civilian activity done for income or pay. That leads you to Y99.0. The correct answer is going to be Y99.0, civilian activity done for income or pay. And your final answer would be W13.4 XXA, Y92.61, Y93.H3, and Y99.0. Outstanding job coders. Now let's move on to the next scenario. Question number two. Of the following answers, which best describes the external cause of the encounter? Options are option A, W54.0XXA, Y92.830, Y93.K1, Y99.8. Option B, W55.01XA, Y92.013, Y93.44, Y99.8. Option C, W54.0XXA, Y92.013, Y93.K1, Y99.8. Option D, W55.01XA, Y92.009, Y93.44, Y99.8. A 9-year-old girl was taken to the urgent care after being bitten by a dog while taking the dog for a walk in a public park. She suffered a puncture wound to her right forearm. Her mother states the dog belonged to a neighbor and child was not provoking animal. She was treated with wound cleaning and tetanus shot. Of the following answer, which best describes the encounter, the external cause of the encounter? And coders, you can start answering the questions. Okay, that is time because I already started the timer when I was reading the scenario. Well, if you haven't completed, please go ahead and keep working on the scenario. Meanwhile, I will start explaining this one. So we have in inventory bitten by a dog, taking her dog for a walk, public park. puncture wound of the right forearm. So the guideline is going to be same as the previous scenario. And let's start by looking into the cause of injury. So we have a patient bitten by a dog, and W54.0 is coding for bitten by dog, while W55.01 is coding for bitten by cat. So in our scenario, we had a dog bite, so option B and option D is incorrect. Now let's look into the option A and C. Y92.830 is coding for the place of occurrence, and it is a public park as a place of occurrence of the external cause, while in option C, Y92.013 is coding for bedroom of a single family house as a place of occurrence of external cause. So in our scenario, the place of occurrence was a public park, and that helps us eliminate option C. Let's go ahead and look into the activity code in option A, and that is going to be Y93.K1, which is coding for activity walk an animal. And yes, we had the patient taking the dog for a walk in our scenario, so that's good code selection. Last, we have to look into the external core status, which is Y99.8, and we can even consider this as a recreational activity, or simply code it under other external core status. So the correct answer is going to be option A, W54.0XXA, Y92.830, Y93.K1, and Y99.8. Outstanding job coders. So before I move on, let me also show how to look up these codes in the external code index. We begin with a bite by the dog. That was our external code. So you will go to the external cause index, search for bite. Under the bite, look for dog. That would lead you to W54.0, and you have to go and verify the code in your tabular list. So W54.0 is an incomplete code. It requires seventh character, and you can assign appropriate seventh character. So next, place of occurrence, go to your place of occurrence in external cause index, search for park, and it was documented that this is a public park. So your answer is going to be Y92.830, which is public park as a place of occurrence of external cause. Next is the activity. So the patient was walking an animal, walking a dog. So go to the activity, search for walking an animal. That leads you to Y93.K1, and there you go. Y93.K1 is for activity, walking an animal. Lastly, status of external cause. You can go under status of external cause and select other specified. That would be Y99.8. And you have all the activities listed under Y99.8 over here. It includes your leisure activity, it includes recreational sports activities, student activity, everything. And this is your final answer. So wonderful job, coders, and I'm going to hand over to Mrs. J. Mrs. J, please, and thank you.
All right, coders, how was chapter 20? Yeah, coding for the health, status and not the injury, that could be a little, it might take a little time to absorb, right? And for some, you get it, and others may need a little more, but it's okay. Now, just like Chapter 20 codes, Chapter 21 codes, factors influencing health status, these are health encounter codes that don't involve an illness or injury. In fact, these codes reflect why a patient is receiving care, such as like a routine checkup, vaccinations, screenings. So they're not diagnoses, no, or illnesses or injuries, no. But these Z codes are very powerful. They are because sometimes they are first listed, right? They can be first listed. And in chapter 21, there is a section, I apologize, I don't know it, but there is a section that outlines those Z code categories that can be first listed. And we reviewed them in pregnancy, we reviewed some of them in perinatal. Yeah, so these are powerful, powerful. They're not diagnoses, but they are indeed powerful and they can be first listed. Okay, so I've said powerful enough. All right. So I'd say chapter 21 helps us code the why behind many healthcare visits, right? Yeah. So it's not in the same context as chapter 20, but chapter 21 also helps us code the why. All right, coders, let's go ahead and review chapter 21, Health Status Coding Guideline, FTRs. FTR number one, Z codes can be reported as a first listed diagnosis or a secondary diagnosis. It depends on the reason for the encounter. Can you think of some chapter 21 codes that you've encountered that can be reported as first listed? Go ahead and list them in the chat. I can think of one right now. Encounter for chemotherapy. Yeah. The newborn code, that Z38. So that's two. What about you, coders? Can you think of any first listed Z codes? All right, so think about screening codes. Yeah, the reason for the encounter. All right. FTR number two, Z codes explain the reason for the encounter when no current illness or injury is present. FTR number three, when coding aftercare codes Z47 through Z48, do not assign a code from Chapter 19. Those are acute injuries. Chapter 19 are acute injuries if you didn't know it. FTR number four, status codes Z79 for long term drug therapy. Oh, I almost forgot about that insulin, right? And there's a status code for cardiac devices. These are permanent unless documentation states otherwise. FTR number five, screening codes. Z11, Z12 are used when a test is performed on a patient who shows no signs or symptoms. And I think we learned that week one when we reviewed um, the section, really section 4 guidelines for outpatient reporting. Wow. Okay, coders, now it's time to solve an ICD-10-CM scenario the AMCI way. Inventory, select first listed, apply guidelines. Okay, Mr. Sandeep, please and thank you.
Thank you, Mrs. J and coders. Here's your first question. Of the following answers, which best describes the encounter? Option A, Z00.01. Option B, Z00.00. Option C, Z01.419. Option D, Z02.89. A 45-year-old man presents to his physician's office for an annual wellness exam. He has no current complaints, no abnormal finding, and no known chronic conditions. The provider performs a comprehensive preventive exam and documents it as a routine general adult checkup. No labs or procedures are ordered outside of standard preventive care. The patient is advised to return in 1 year. Of the following answers, which best describes the encounter? Your clock has already started ticking, and we'll see after the time. All the best. And that is time, and you all are rocking it in the chat. So let's have a look into the inventories. So in inventory, we have a 45-year-old annual wellness exam, no current complaints, no abnormal findings, and patient has been asked to return in 1 year. So let's go ahead and let's solve this scenario. And coders, we are going to refer the guideline number C21, C13 to solve this scenario. And the guideline states that C codes allow for the description of encounter for routine examination, such as general checkup. And it further states that some of the codes for routine health examination distinguish between with and without abnormal findings. The code assignment depends on the information that is known at the time of encounter being coded. So we have a 45-year-old patient presenting for an annual wellness exam. There were no current complaints and no abnormal findings at all. And the patient was also asked to return in 1 year. So now let us look into the code options which we have. Option C is coding for Z01.419, which is for an encounter for gynecological examination without abnormal findings. So we have a patient presenting for annual wellness exam. Moreover, this is a male patient. So option C, Z01.419 has to go. Option D is coding for Z02.89. That is for encounter for other administrative examination. And you can see the different types of examination which can be coded under Z02.89. We had the patient presenting for annual wellness exam, so we can eliminate option D as well. Now we are left with options A and B, and option A is coding for Z00.01 and option B is coding for Z00.00. So Z00.01 is for encounter for general adult examination with abnormal findings. And the instructional note also says to use additional code to identify abnormal finding. Just as we reviewed, we have a patient for general examination, annual wellness examination without abnormal findings. So we can eliminate option A as well. The correct answer is going to be Z00.00, which is for encounter for general adult medical examination without abnormal findings. So option B is your correct answer. Great answers, by the way. So let us move on to the next question. Your second question of the following answers, which best describes the encounter? Option A, Z47.1, Z96.651, option B, Z09, option C, M17.11, option D, Z48.89. A 60-year-old woman is seen by her orthopedic specialist for follow-up care after having a total knee replacement performed 6 weeks ago. The provider notes that there are no complications and the patient is healing well. The visit is specifically for continued care related to her joint replacement and includes physical therapy progress check. No acute conditions or no new complaints are addressed during this encounter. Of the following answers, which best describes the encounter? And your time begins now. That's time, and as always, you are doing a great job in the chat. So let us review the inventory. We have a patient who had total knee replacement 6 weeks ago, no complaints, continued care related to her joint replacement. So let's go ahead and break down the scenario. So we are going to refer the guideline C21, C7 for solving this scenario, and it states that aftercare visit codes cover situation when the initial treatment of a disease has been performed and patient requires continued care during the healing or recovery phase or for the long-term consequence of the disease. And option number C, M17.11, is coding for a unilateral primary osteoarthritis of right knee. Well, there is no documentation to support an osteoarthritis condition. That means option C is incorrect. And code Z09 is for encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. Well, option PZ09 is incorrect because in our scenario, patient is here for a continued care related to her knee replacement, knee joint replacement, and it also includes a physical therapy progress check. And these follow-up codes are used to explain continued surveillance following a completed treatment of a disease. So when we have a continued care, it is more appropriate to code aftercare codes and not a follow-up care. That means Z09 is also incorrect, and option D is coding for Z48.89, that is for encounter for other specified surgical aftercare. Now this is incorrect because we have a more specific code in Z47.1, which is for aftercare following a joint replacement surgery. And the instructional note also asks us to use additional code to identify the joint. So we can use Z96.651 to indicate the presence of right artificial knee joint. That means correct answer is going to be option A, Z47.1, Z96.651, and great coding. Everyone did a fantastic job, and I am going to hand over to Miss J. Miss J, please, and thank you.
Thank you, Mr. Sandeep. This sums up our instruction. Just want to remind you to continue self studying chapters 18 through 22. Yeah, we didn't hit 22, but there really aren't too many guidelines that weren't reviewed in subsequent chapters. You'll see when you get to it. It's only a few there. All right, so if you have the MCG, go ahead and study in your MCG. This is a great tool when you are learning. I've seen people say, hey, can you take the MCG with you when you take your exam? Absolutely not. But you can document what's in the MCG in your coding manuals. Okay, let's talk about homework. All right, so to get the homework, if this is your first time watching, go ahead to our website, www.amcicoding.com, click on YouTube course, and you're going to look for the syllabus. Coders, not coders, team, put the syllabus link in the chat if anyone needs it. You don't have to go to the website. The syllabus link is in the chat. And if you go to the website, scroll, read it, then scroll down until you get here where it says 16-week YouTube course, you can download the syllabus there. So if you didn't get it in class, you can get it here. And after you click on the syllabus, you'll see the books. And this week, this is pretty much week 8, and this is what the homework is for week 8. Number 1, download the class PowerPoint playback. If you are in Discord, that is where you can find it. Number 2, watch the playback from Monday's class today, right? Go ahead and watch the playback if you need to. Number three, read the official guidelines. You can read them from here, the CMS copy, or here, the MCG. Number five, go ahead and read from Carol Buck's Unit 2, Chapter 7, Signs, Symptoms, Injuries, External Causes, and um, what is the last one? It's not written here, so I do apologize. Um, oh, factors influencing health status. Yeah. All right. All right. So here they are. And also make sure you do that chapter review. There's a chapter review after. Okay. And number six, we have some additional lectures for you, one on burns and one on external causes and how to look up the codes. And finally, go get your additional practice questions in Discord. There it is. And don't hand it in because you don't have to. But if you have questions, go ahead and put them in Discord. Yeah. So whatever section you're on, whatever section we're on, just go to that section in Discord. Right now, we are in signs, symptoms, injuries, external causes. Put it right there. Encoders, you have did it. You completed week 8. You've completed all of the weeks of ICD-10-CM instructions. You are incredible. Now it's time to move on to CPT, coding instruction. Now, coders, just want to let you know we're going to take a break next week and we'll be back the following week. Please look at your syllabus for instructions. All right? So the date and everything is on your syllabus. So if you need to get caught up, this is your time to get caught up. We need to get caught up and we've got boot camp. So because we've got boot camp, we need to really focus our attention on our boot camp, and we'll be back the following week. And we just want to thank you, coders. We want to thank you for an amazing 8 weeks and let us know how it was for you. Please take a moment to fill out our survey. Let us know because we read these surveys and completing the survey helps us help you. So, team, please place the link in the chat for these amazing coders. And if you can, coders, please like it up, click like up if you liked class tonight. If you didn't like it, click like down. I like to say like down. Again, I'm positive. Be positive. We insist here because positivity keeps you thriving. I believe that. And thank you to my team. You are amazing. You are among the best there are. You do the work. You put in the work. You put in the hours. And I just want to thank you. And coders, I'm going to tell you, they are volunteering for this project. So please let them know in the chat that you appreciate them. Let those interns know too. They are incredible. Oh, by the way, they're getting ready to get something started in that Discord. So I think you better get in there. They are going to, you are going to have a great time. I know I'm going to be in there. Okay, everybody, just want to say so long. Thank you, coders. I don't have any parting words tonight or today, whenever you're watching, but I do want to say this because I want you to remember go study, go practice, and go be great because, coders, you are great. Believe it. All right, coders, we'll see you in the next session. And until next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast, we're all around.